Hello to all of you. It's really an honor to be here among so many inspirational speakers and people here today. So my name is Adele Waugaman. I'm the Senior Director of Technology Partnerships at the United Nations Foundation, which is a charity, an American charity that works very closely with the UN. And what we do is we help to build bridges between the private sector, individuals, groups outside of the UN system who want to partner with the UN and their work for global good. So I'm going to talk to you a little bit about a program we have using mobile technology to support and strengthen development work. And when I was thinking about what to come here and talk to you all about today, I talked to some of the folks who had been at MLOVE in past years, and everyone told me unanimously, get up there and talk about what you're passionate about. And so I thought rather than just launching straight into an overview of what I do during my 9 to 5, I'd talk a little bit about what inspires passion in me. And this is a photo. Does anybody recognize the city by any chance? Cape Town. Yeah, this is Cape Town. So I had the chance to go back to Cape Town for the first time in over 10 years just recently. It is a beautiful place. I pulled back the window, the curtain from my hotel room, and this is literally what I saw, this amazing double rainbow arcing over Cape Town. You see Table Mountain there in the background. Another view of Cape Town. It is, I think, potentially the most beautiful place on Earth with amazing wildlife, penguins, who doesn't like penguins, all different kinds of wildlife. But the reason why South Africa really, to me, inspires passion is because I think it is perhaps the best political demonstration of recent times of the triumph of the human spirit. So many people will remember it wasn't too long ago that South Africa was ruled by the apartheid regime that forced people by color into different parts of the city. And it was a traumatic period for the vast majority of South Africa's population. People who opposed the regime were either forced into exile or many of them were imprisoned, some tortured and killed. This is a photo of Robben Island, whose most famous prisoner was this man here, Nelson Mandela, who, along with a small team of other people, really transformed that country and enabled South Africa to undergo this very difficult transition from a fragile state into a thriving democracy. So I was there in 1997. That was a year and a half after apartheid ended, and I had the opportunity to study at a non-white university. This is University of the Western Cape. This is the cafeteria area. So I got to experience firsthand how excited people were to see this transformation happen in their country and to be part of a democracy. And every single student, I think probably without exception, was a member of some kind of a political organization, and they had done their part to lobby for change, to get their family members out to vote, and they all felt like they had a stake in the new country and in the new South Africa. And I just marveled at that. I think the last time in the United States we had something like that, at least in 1997, was the Civil Rights Movement, and that was before my time. So I was just blown away by the extent to which the average student was so passionate about their country. So Ubuntu, this is something I learned a lot about in South Africa. Who here knows what this is? Raise your hand. Okay, who can tell me what it is? Shout it out. Linux. And there's another definition. Do you guys know the other definition of Ubuntu? Freedom, yeah. So, right, Wikipedia says exactly, operating system on Linux. This is also an African, here we go, humanist philosophy, focusing on people's allegiances and relations with one another. And so essentially this idea of Ubuntu was basically, at least my understanding of it, was people understanding that we have a shared history, a shared future as South Africans, and this shared humanity is actually larger than the trauma of the past. It is this guiding light that will take us together to a shared future. Desmond Tutu, who was another key figure in South Africa's transition, says Ubuntu speaks particularly about the fact that you can exist as a human being in isolation. It speaks about our interconnectedness. And of course, when we think about interconnectedness today, we think about technology. This looks like a friend map on Facebook or LinkedIn connections. So technology is really coming behind this idea of a concept like Ubuntu, of a shared humanity, and giving us new tools to work together. And what nobody could have known back when I was in South Africa in 1997 was that the power of the network that was connecting most of the high-income countries around the world through the World Wide Web was about to get a major boost in the developing world through a single tool that was going to revolutionize the way communications was happening in the developing world, and that, of course, is the mobile phone. So even low-end handsets, we're seeing them being used in very innovative ways to support all kinds of projects. I think it's worth pausing and remembering the staggering growth that we're seeing in mobile phones. So the year 2011 started out with 5.3 billion mobile subscriptions worldwide. Of those 5.3 billion subscriptions, 3.5 were in developing world. 90% of the world has access now to a mobile signal, including 80% of populations in rural areas. So this is tremendous growth. And the International Telecommunications Union, the ITU, which is actually a part of the UN system, went as far as to call it the mobile miracle. They chart mobile growth from 98 over a 10-year period, and you see it literally just dwarfing all other kinds of information communications technologies, tripling the number of fixed-line telephones, doubling the number of internet users, although increasingly now people are, of course, getting access to the internet through mobile phones. So in case there's anyone who doesn't recognize what this is a NASA computer from the year 1969. 1969, some may remember, is actually the year that NASA put a man on the moon. And it's said that the majority of cell phones in use today have more computing power than NASA computers of 1969, which is pretty phenomenal when you think about it. So cell phones are transformers. They're changing the way that we do business, they're changing the way that we live, the way we socialize, but they're also radically transforming institutions. And we just need to pick up the newspaper and read recent headlines about the Arab Spring to think about what networks and mobile-enabled networks in places where there is not ready access to computers is enabling. Ooh, that's bad resolution. This slide is meant to represent the advent of the printing press. It's said that mobile communications and the leap in communications that it's enabling is the biggest systemic shift in the way that we communicate with one another since the printing press, which, of course, you'll remember essentially made it easier for people to create and share ideas. So mass literacy, the Protestant Reformation, the Enlightenment, all of these things were products of the printing press. And I think we're seeing something similar with the mobile phone, which is rolling out a new era of communications, making it easier for people to have their voice be heard. So what does this mean in the context of development? This is a photo of Kailicha, which is one of the townships in South Africa from which a number of the students who I studied with at University of the Western Cape came from and called home. Living conditions in a number of these townships were really rough, and this is a reality for a large percentage, significant percentage of the world population that lives on less than $2 a day. So it's because of the reality of these conditions and the potential of mobile that I feel particularly lucky to have the position I have, which is managing a partnership between Vodafone, one of the world's largest mobile operators, and the United Nations, which is, of course, the world's largest humanitarian system. The UN has tremendous global reach. There are 192 member states, which is every sovereign territory except for the Vatican, and covers a range of issues from health and water to climate change, children's health, and much more. Vodafone similarly has a very large reach, dozens of countries, people all over the world. So what happened was in 2005, the two foundations came together, the United Nations Foundation, which works with the UN, the Vodafone Foundation working with Vodafone, and said, what if we could take the power of mobile technology and combine that with the reach of humanitarian programs that the UN system represents. And through a $30 million approximately commitment, we have looked at how we can leverage the power of wireless technology to support health and disaster relief programs. So who knows who this guy is? Ted Turner, yeah. Known for a lot of things, CNN, Atlanta Braves, owns a lot of land in the United States and Argentina. Lesser known fact is that he is a major philanthropist. It was with his $1 billion that the UN Foundation was created. He originally just wanted to write a check to the UN and help pay the debt that the United States had accrued there. Turns out, in fact, individuals can't write checks to the UN, so instead he created the UN Foundation, thus creating a vehicle that other people could partner with to support the UN. So he committed $1 billion. And already we've leveraged almost $2 billion to support the UN through other partnerships like the Vodafone partnership. So one of the major areas that the UN Foundation works on is health. Health, of course, is a fundamental building block to development. Without healthy societies, you can't have healthy democracies or healthy economies. Significant challenges in the developing world. Perhaps most important is that in many parts of the world where you have the highest disease burdens, you have the lowest number of hospital beds to patients, the lowest number of skilled health workers to people who need health care, and that's a significant problem. So the UN Foundation and Vodafone Foundation have been working together through a project called the Measles Initiative. Back in 2000, 750,000 children per year were dying of measles. Between 2000 and 2008, through the combined work of a number of partners, including the two foundations, that rate was lowered by 78%. So we're making significant progress in reducing the number of children who die each year from measles, but there's still important work that needs to be done. And part of the reason why there is this challenge that remains is because there's a real lack of health data in the developing world. If you open up a book, or if you go to CIA fact book online and you look at the statistics about mortality, frequently those statistics are actually 3 to 5 years old. So a lack of regular health data really impedes effective health decision-making in the developing world. So what we decided to do was we looked at all of the health data that was being collected by paper and said, what if we could do this using mobile technology instead? So with an NGO called Datadyne and with the World Health Organization, we created a program that would invest in the software to enable this to be done, and then also invest in trainings that would enable health workers to begin using mobile technology in place of paper. So what is mHealth? I'm sure most people here have heard of it before, but it's essentially using mobile devices to support health information and service delivery. And so why should we use mobile technology to support healthcare? Well, it reduces delays in the time that is required for patients to receive care. It can improve clinical outcomes, and services can be delivered at reduced cost and increased speed. So this is all particularly important in environments where you have a weakened health infrastructure. Here you have an example of a health survey that's running on a Nokia phone, and what it enables people to do, in addition to replacing these reams of paper that people were having to carry around, it also has smart advancing features. So depending on how the respondent is answering the questions, you're skipping ahead in the survey, making it easier for the health worker as well. We have worked with a social enterprise that primarily uses a team of developers based in Nairobi, Kenya, and also in Lima, Peru. And they've developed a concept called Coded in Country, with the idea that tools should be developed locally in order to have local relevance. Again, not great resolution, but this is an example of what it looks like when you're going door to door and collecting information from household to household about, for example, how many children have been vaccinated, doing it by mobile phone instead of by paper. So what have we seen through this process? We've seen, A, that health workers get it. It makes their job easier. They want to use mobile technology instead of paper. We're also seeing that the survey forms, because they're open source and can be modified by the user, have been used in ways we didn't anticipate initially. So this is an example, the BBC covered it, a mobile phone-based health application that's EpiSurveyor, used after a polio outbreak in Kenya, essentially going door to door to track, to follow the footsteps of it was actually a refugee community who had reintroduced the polio virus into Kenya for the first time in nearly 2 decades. And by using mobile technology, they were able to get the follow-up vaccination coverage done much more quickly. Also, stockouts in Zambia is another example. We sent in an evaluation team and saw that, in fact, there was an 80% outage of a supply of malaria medication, and they were able to identify that quickly using mobile technology, make sure the medicine was there, because as you can imagine, if you're a mother with a sick child, if you walk all the way to the clinic, you want to make sure that the medicine you need is there. Similarly, in Senegal, being used to track a lack of availability of these pink forms here. This is called a partograph. It's used to make sure that mothers are able to deliver healthy babies. And so using mobile technology, quickly identify the fact that those forms were in short supply and fix it. So the World Health Organization recently produced a report looking at mobile health use globally. It showed that there is indeed a groundswell of mobile health activity. 83% of countries around the world said they were using at least one mobile health tool. And so we see that there are lots of opportunities here. A range of different ways mobile tools can be used, from education to data collection, remote monitoring, and disease and emergency tracking, all contributing to this rise in health activity worldwide. So just to zoom back out and talk about some of the trends that we've seen through our work, this guy here is Bernard Wambu. He is one of the heads of health data collection in Kenya, and when he first started using mobile technology to collect health information, he went out with one of the lead developers who was showing him on a computer how the data was coming in from different parts, different provinces around Kenya. And instead of looking really enthused about the fact that he could see all this information in real time, instead he looked perplexed. And so we were trying to get to the bottom of that, and he's pointing out the fact that there's one province that's not reporting data. And because this was all happening in a real-time environment, he was able to pick up the phone, call the person who was supposed to be gathering the data, and ask him why the data wasn't appearing. So this real-time data environment created a new level of accountability and transparency, where the health manager was able to immediately pick up the phone and call the guy and say, hey buddy, you're not doing what you're supposed to be doing, we need that information, get on it, which happened. The other thing that real-time data can do, and this is to the O-Power example, is create incentives. Because when you collect, if you're a health worker, when you collect data and at the end of the day you see how much data you were able to collect and you can compare that with your neighbors in other provinces, that gives you a sense of how the work you're doing shapes up relative to your neighbors, and it gives you more incentive to do well. It's also still early days for mobile-based development projects. That's something that we heard again and again from our partners in the field, who said that there is a huge amount of enthusiasm for this, but we need to be patient and move slowly. And finally, there's a lot we can learn about innovation that's being driven by the developing world, particularly because of the leapfrogging that's taking place. So we've put together a report, thank you, called Mobilizing Development. It looks back at 5 years of work that we've done leveraging mobile technology in the global health and emergency communication space. I brought several copies, which are in the back room there, so please help yourself if you're interested. And that's all I have for you. Thank you very much.